Roberto Liddi is chair of ABHI's Digital Health Group. Roberto from Sensyne Health. Roberto, thanks for joining us today. People are always interested. Just tell us a little bit about yourself and your background that's relevant to your leadership of the digital group.
Sure. Number one, thank you very much for this invitation, Richard. Always a pleasure to talking to you. So I'm Roberto Liddi. I am currently the Chief Regulatory Officer at Sensyne Health, software as a medical device manufacturer, British-based manufacturer. I've been in industry or medical device industry for over 25 years, spanning a lot of experience through probably any type of device and IVD that you can find out there. Worked for very big companies of the likes of Zimmer Biomet and KCI, two big IVD manufacturers, and I would say only recently, and by that I mean the past 6-7 years, starting to have a keen interest in software as a medical device. At the beginning, software integrated, so as part of a system of other medical devices. I used to work in stereotactic surgery, so brain surgery driven by software, and then more lately Sensyne in standalone software. So that's where my interest has been. I've been part of several groups at that time it was called EUCOMED level at European Commission. So I used to walk the European Commission corridors quite frequently, and obviously as a result also I have been dealing and working with you at ABHI for quite a while. So that's really my background.
That's a great background, Roberto. Thank you. One of the real statesmen of our industry. Next question for you, and this is probably nearly impossible to answer, and you've touched on some of it. Digital health covers a whole multitude of things, doesn't it? Maybe just give us an idea of some of the applications of it that our members are delivering.
Yeah. So that's a 1 million question right there. But yes, this is probably why I am now concentrating this. It's just so exciting. It's a constantly moving target. I think the knowledge of what can be done is in the industry, and regulators are playing catch up. Seriously, they're playing catch up. It wasn't like this 20 years ago. The world was the other way around. Industry needed to think of way of applying new rules set by the regulators. Now we industry have the tools. We know what's coming. We know what can be done with software. And digital health tech is under the spotlight every day. We know it. Probably instigated by the entry into the medical field of purely software company. If you look at things like Amazon, Google, Apple, that are starting to have a keen interest in the healthcare sector, that's where you have this new lease of life, shall I say, for our medical device industry, which is at a cuspid between health tech and software. What is the result of this fusion, shall I say, of two new different technologies? Is things that are not necessarily fully understood by the general public. Everybody seems to be talking about artificial intelligence. Everybody seems to be talking about machine learning. But the application of those for the benefit of the patient is what really excites me. And I'm sure that it excites a lot of our members as well. In fact, pretty much all the members of our working group are in the field, from predicting a specific clinical pathway of a patient to diagnosing, and there's quite a few now, diagnosing cancers through image, much not better but faster than what clinicians do. So the general aim of our industry, digital health industry, is actually to give support for a clinical need. We know that today look at the GPs. Look at the GPs waiting list. GPs are in UK, what have they got? 2 minutes, 30 seconds to see a patient. What does that tell you? We are in a society where speed is of essence. And speed can only be achieved with digital tools. So the main goal of all our members is to give those tools with the required level of safety and performance as dictated by the rules to the clinician to perform a better job, to look better and faster after more patients than he or she could.
That's great, Roberto. I mean, interesting. We're recording this on the 6th of October, 21. Yesterday, we had our digital health conference, and that question of software as a medical device came up a lot. Really, really interesting. Generated a lot of questions and got people thinking about what was applicable and what wasn't. And then the challenge with GPs. So I don't think we've ever used a telephone very well in this country to deliver healthcare. So Roberto, with all that going on and all that excitement, as you say, very, very exciting. Just tell us a little bit about what the digital health group, ABHI's digital health group, is actually working on at the moment.
So we are in I think we are at a turning point in our industry. Brexit obviously has been one of those factors. We're not here to discuss that, but it has been a factor in deciding how our regulator in UK is moving ahead. The recognition that the industry can be a very, very important financial interest from a lot of other countries basically come and work here because that's where things happen. The change of regulations, specifically in the medical device and IVD, which we are in a transition phase at the moment in Europe and to some respect in UK as well, and also the recognition of the government that this is one of the most interesting and leading and commercially viable type of industries has obviously led to a situation whereby our regulatory and authority, MHRA, is now proposing a new way of regulating. So within the big goal of restructuring the framework of a medical device, probably trying to align it much more to the European MDR, which is just this year came into force, IVDR, in vitro diagnostic regulations come into force next year. So during this transition phase, MHRA has very timely decided to refresh our regulatory system. And within that, the recognition of software as a standalone, and more specifically, artificial intelligence as a medical device, to play a role as a new type of product. That's what our group is concentrating on, is trying to understand how industry can support the regulatory bodies in making sure that the coming and proposed regulation is apt to cater for the industry, is applicable, and also takes into consideration the ever-changing status of the software itself. I'll give you an example. In the purely software industry, it wouldn't have been difficult to create a new version of a software every 2 weeks. In our world of medical device, changing a version of a medical device every 2 weeks are pretty much impossible. It would take, I don't know, 6 months maybe on average. So finding something that can work and keeps producing a device or a product that is safe and performs as intended at that rate of speed, that's where the challenge is. We know how to do it. A lot of our members do it on a day-to-day basis. And we believe that we could be of critical importance to make sure that the regulations that come to force will be the right one.
So Roberto, plenty to keep us busy there and keep the group busy. I think you said something really interesting there about how industry is leading the way and regulators are catching up, as well as the consultation on UKCA marking that we're on the future of that we're right in the middle of at the moment. There's a broader consultation out on how we actually go about the business of doing regulation in our country, and I think digital health will be right at the very, very forefront of that, and I look forward to working with you on that. That just leaves me to say, Roberto, thank you so much for your time today and your energy leading our group. It is patently exciting. You've put that across really, really well, and we look forward to hearing from the group and your additional outputs in the months and years ahead. Roberto, thank you very much.
My pleasure, Richard. Thank you very much.